Hello, good morning. Pilot projects. I'm Kai Friedrich Niermann. I'm consulting and representing the cannabis industry as a lawyer since 2019. We have an exceptional panel here, lots of expertise on pilot projects. Paul Lucas Goth couldn't make it, unfortunately, so we are just the four of us. Please, guys, would you like to introduce yourself? Who are you and what are you working on?
Yes, thank you so much. So my name is Daniel Hübner. I'm working here in Berlin for the Humboldt University. It's a really old university in Germany. And I'm also part of the Cannabis Research Lab. The Cannabis Research Lab is an interdisciplinary lab for cannabis science, especially contract cannabis science. And at the moment we are doing mostly pilot projects and scientific work on this.
What kind of scientist are you?
I'm an agricultural scientist by school and do my PhD in cannabis cultivation in closed embedded systems. This is my PhD topic. And I'm mostly looking into the biology parts of the plant, but I'm also working on a working group for the Green Party here in Berlin in drug policies. And that's the reason why I was so interested into the pilot programs. Yeah.
Okay, thank you. Finn?
Cool. Hi, I'm Finn. I'm the founder and CEO of Sanity Group. We are probably one of the leading, I guess, top 5 European cannabis companies by revenues. And well, I'm originally coming from the tech world and founded the Sanity Group in 2017 and 2018 when the law changed in Germany regarding medical cannabis. And what am I working on? I think we are one of the only companies in the market that is doing both. Like on the one hand, we are one of the leading companies in German medical cannabis. But on the other hand, we were very early on a few years ago where the Swiss pilot project started in recreational adult use. We run a pilot project in Switzerland for almost 2 years now in the canton of Basel-Land. And we hope that with the German KG or KG, which is the law that is currently in place, we will be able to get up to 5 pilot projects also in Germany, but we'll talk about that one later on.
Hi, my name is Deepak Anand. I am the principal at ASDA Consultancy Services. We're a global kind of consulting advisory firm for companies looking to enter new markets and new industries and kind of advise them on go-to-market strategy and things of that nature. So happy to be here.
Thank you. Thank you for being here. So, okay, you have heard a lot of pilot projects this morning already, but I will try to summarize it once again. As the new reform measure was introduced in 2023, it was Pillar 1 for home grow and cultivation associations, and Pillar 2 was announced for pilot projects. This Pillar 2 didn't came. The last government didn't take care of that. They had hands full to do with implementing Pillar 1. But there was this scientific clause in the KG allowing scientific projects, scientific endeavors to be granted, to be authorized by application. So at this point we have almost over 30 applications and the authority in charge is the BLE. It's a department of the Ministry of Agriculture. And they confirmed the applications that they received that. They developed in the meantime a questionnaire, an official questionnaire for these applications. And the applicants already got some feedback we can talk about later on. So this is ongoing. The problem is Pillar 2 was designed or was thought of as a separate law. Which stipulates all the preconditions for model projects nationwide, so that you have a nationwide, that it is nationwide applicable, and that the findings which were generated in these model projects could be compared. So that was the idea, that you have a nationwide framework for these model projects. This didn't happen, so companies use these clause, these scientific clause, and the problem is that it is necessary to generate data on safe consumption, on economic structures, and how the black market, the illegal market, is tackled. And but the law also says it's only in exceptional cases. That's the problem. If you have 100, 150 model projects, it's not an exceptional case anymore. They all generate their own data. They are not compared or aligned to each other. But when you say, okay, we only grant it to one company, one model project, then the others will sue the BLE for not taking part in this approach. So that's a little bit of the problem. But they are working on these applications, and we will see in the next 3 to 4 months what will happen. So let's take a deeper dive into that, and we will start with the study design. Daniel, please give us an overview of the study design. What's the objective of these model projects? What are you looking at, and how deep you go into that, and what you want to achieve?
Yes. So it's really open. You could answer almost any questions, and there are many questions out there. So these model projects could answer, for example, a question about the health system, about what does cannabis consumption in recreational purposes to the mind, to the body, for example. But there are also different approaches. I have to be transparent, I not only have one model project, I did 6 different projects with different study designs. And one, for example, is about the economic benefits of a pilot program for a smaller city in Brandenburg. So, for example, how many jobs can be made by one of these pilot programs? What happens to the economy? What happens to the taxes? How much will be paid? For transparency, we are working also together with Finn. So we have together one pilot program, and it's very similar to the pilot program in Switzerland. And there, it's a naturalistic observational study. And we want to see how, like this open shop, can help the people and to consume with less problems. So less tobacco, for example, and it's all about harm reduction. So our idea is when you have like a shop where you can get clean cannabis and also good people who are telling you a little bit about what is a vaporizer, for example, or what are edibles, the people start to smoke less joints, more vaporizers, and maybe in the best case, only eating edibles, what is, in my opinion, the best way of consuming cannabis when children are not getting it in the hands. Yeah, and but there would be even many more questions they could answer. Yeah.
So it's not only reduced to health and harm reduction policies, issues, it's broader.
It's broader, much more. You could answer almost any question with that. But I see the health questions are maybe the most important ones. And these should also be like then, the main part of the pilot programs. But in my opinion, the pilot programs should answer the critical questions what politicians always ask us. So because there are many brolage, I would say, like many things that people think about, especially politicians. They're not so deep into the cannabis topic like we are. So there are many misleading informations out there. So our pilot programs should answer especially that, especially now when we have a new CSU Agrar Ministry of Agrar Ministry or CDU Ministry of Health. We need really good data for continuing our travel with cannabis in Germany.
How is the data collected? By questionnaire? How is the participant? How much does he have to work with in the project?
Let's focus on the project we have here in Berlin with the Sanity Group together. So it's a naturalistic observational study, as I said, that means there is no intervention group or something. We're just looking into what happens in a naturalistic environment, and we're sending out every 6 months questionnaire. And with this, we can see changes in the behavior of the people. And for example, I'm an agriculturalist, so I'm not doing the real research here. I'm more like doing the management behind this project. So this will be made by our professor, Matthias Ziegler. He's a psychologist.
Okay, got it. Finn, do you want to add something to the study design?
Yeah, I mean,
also experience in Switzerland and with these projects.
Exactly. I mean, if you're aware of the Swiss pilot projects, they're very interesting. They're mostly on a rather small scale, like 1,000 to maximum 5,000 people participating. Our project in Basel-Land can go, I think, up to 4,000 people. We probably filled it by half now. So we have 2,000 people in the study approximately. And in Switzerland, and that's a big difference to the study design in Germany, even though harm reduction is the same, but it's very hard to qualify for such a project. So if you want to...
As a participant? Or
yeah, as a participant, yeah. So if you want to participate in the Swiss pilot projects, you have to give a urine test on the spot to show that you're actually a THC consumer. So that is already means you need to go into the shop before, you need to have interviews, so it's a longer process. The study design in Germany will be more, as Daniel said, naturalistic, so you can come into the shop and become like a participant of the study straight away. You don't need to go through the long process like in Switzerland, and we hope that this will lead to a much better, let's say, acceptance by potential customers. Because the thing is, if you are a customer, and one of the pilot projects with Daniel together is here in Berlin, so hopefully next year at the ICBC, we have a store next door that you can visit after ICBC. Let's see, I mean, that's my big hope. But the difference is if you are a consumer of the illegal market or a medical patient, you need to have an incentive to go into the legal supply chain, right? And if you then have a 3 hours recruiting process with several interviews, you will probably just stay with your dealer or stay with your medical platform. And that's the reason why the pilot projects in Germany that we design are focusing on having relatively low entry barriers to make sure that real consumers are actually participating. And just because you ask for health benefits in the beginning, what I see is very important is at the moment you see that the medical supply chain gets used a lot by probably also regular cannabis consumers who probably don't have a strong medical indication. And I think the pilot project could be a good way to get patients who are only using recreational really into a recreational setup and see how that works from a statistics perspective.
Okay, thank you. Deepak, you are also working on a pilot project or consulting a pilot project in Switzerland. Can you say something about that? What's your experience?
Yeah, look, I mean, I think, Canada provides a really good backdrop in terms of what to expect post-legalization. And a lot of the insights that are coming from Canada, exactly as Finn said, right? You've got a medical model that's now being used by patients to be able to access cannabis for a variety of purposes, not necessarily truly pharmaceutical and medical purposes, but it provides a good pathway to be able to look at what does legalization look like in Europe eventually. Canada has, outlined a really, really good path on what happens in public health, what happens with public safety, what happens with underage access. So all of the conversations that you're having now in Europe and the concerns that politicians are bringing forth have already been addressed. I mean, Canada legalized cannabis from a public health perspective. And to that extent, I think we've succeeded quite phenomenally with respect to achieving the goals of legalization, right? Of course, there's been public market failures and other issues, but from strictly a public policy perspective, as well as a regulatory policy perspective, it's been a success. You look at UN treaties, how do you deal with UN treaties? We're still technically in non-compliance. We're the only G7 country to have fully federally legalized cannabis. And I think the pilot projects provide a really good pathway to start to have that conversation at a higher level. As an example, the government of Canada is working with Switzerland, working with Luxembourg, working with Malta as a working group to be able to advise them on how we went about legalization, and taking that to a higher level political conversation is really some of the insights I'm providing politicians as well as countries that are looking at setting up pilot projects.
I mean, that is sort of a problem, isn't it? We know the outcome of the studies, as we see in Canada, in a real lab, or in Uruguay, yeah. So, Daniel, tell me, are there any restrictions on the participants, on the limits of the participants? And
Sure, there are different criteria, and this is something what also is part of the study design. So every pilot program has probably, I haven't seen all of the proposals, different criteria. So for us, it's very important that we don't have people who have already like mental illnesses, for example. So this is something what we are checking if this is the case. If it's the case, they cannot be part of the study. Then the people have to be at least 18 years old. Other programs say they have to be 21. I hear it now in Leipzig they have to be 25. So this could be also a criteria, but this is also depends on the study you're looking on. Then also mental illness, for sure the people cannot be, or the woman cannot be pregnant. This is really important. In Switzerland they even had to make a test for that. In Germany this would be not the case, but the people have to be honest when it comes to that. And in some studies, not in all of them, I think you should not be a patient of medical cannabis, what is a little bit contrary to what you said, because you want to have the not patients, but I think the line between a patient and a non-patient is quite thin, and you could argue that everyone is kind of a patient, but this is a different talk, I think. But yeah, there are different criteria you have to fulfill or not fulfill to be part of the program.
And do you intend to limit the number of participants?
Yes. This is maybe also an interesting question, and what will probably also be part of the discussion with the BLE, so with the authorities. So for statistically, you need around about 2,000 people for getting statistical significance, or that you can make your statistic tests. And there are already people inside calculated who can leave the project. But for sure, someone has to pay the rent for the shops and the bartenders, and there are coming costs. So 2,000 is maybe not enough to have a economic function thing. But there, I'm not the expert. You have to ask Finn, where's the line between?
Yeah. We come to that in a minute. Yeah. But the financing is the next topic. So just on your side, can you tell about that? How do you finance in the university these projects?
So the projects are getting financed by themselves, because we don't give away the cannabis for free. The people who are being part of the study, it has to be like that because it's a naturalistic design. They have to pay something, otherwise it would be not a representative study anymore. And there is then cannabis you can buy to normal market prices, like between 8 and 12 euros, something like that. And there is also a part what pays then the scientific staff, and this is quite normal. And I know what you're aiming for. A big criticism point was the freedom of science or something, or how can be something independent if we're getting paid from the project. But there I have to tell you, this is the case in so many projects. So I'm working in agricultural sciences since many years, and it's an applied science. And actually, it is part of our work to bring our science in the real world. So no scientific project can rely only on government money. There are so many contract research and third-party research. This is completely normal in Germany and also in other countries, but it doesn't mean that we are not completely independent. So I can tell you 3 different points why we are independent there. So first of all, when we want to do some of these studies, we have to do not only a proposal for the authorities, we also have to make a proposal internal in our ethically consortium.
Ethical memorandum.
Exactly. And we have to tell then exactly how the money flows are, and what is the sanity group, for example, or grassroots project.
Within your university,
Exactly. So there's, for every university, there is this memorandum, and we have to do a long proposal for that, 80 sites or something, for every project we are doing. And they're looking very good on it. And another point is the ownership of the data. So our university is always the owner of the data, and it doesn't matter what we are finding out, we will publish it. Like the Humboldt University is now around about 200 years old. We were working on our good name since these 200 years. And it's not so much money that we would like waste this good name for that. But this is not only this project. There are many projects where we're working together. For example, with Rewe or with big players, especially in the food science aspects. And we are.
This is well known. This is this third-party funding of University of Scientific Projects. Yeah? But you charge the companies for the applications you're helping them with.
Yes, there is like, for example, I have to work on these projects and I cannot work for free. I have to also get money to pay my rent and everything. And this is just how it works. But we also say you have to pay a certain amount when you want that we write the proposal. And you have to pay this nevertheless if it's getting approved or not. So, but it's very transparent. We tell you exactly which hours we are working and how much it is. And this is for every research project the same. If we are testing new LED lamps, for example, it works the same. We even have like you could call it a company. It's the Humboldt Innovation. It's a GmbH, so it's a limited company. And this is especially for third-party and contract research projects. So it's very normal for universities in Germany.
Okay. Finn, tell us, how does the collaboration with these scientific institutions look like? What are you experiencing?
Yeah, I mean, to be honest, like, let's start in Switzerland, because I think that's a very good case. In Switzerland, what Daniel also mentioned, it's very important that we completely differentiate between the task of the university, #scientific independence, and what we are doing as a company, like means operating the stores, running the brands, importing the product, or like organizing the product and making sure how the dispensary looks like, how it's sold, and obviously the way how we educate our bud tenders is obviously also part of the research design. But there's a clear separation between the scientific part and the operational part. And so, for example, in Switzerland, we as a company don't have access to customer data. Only the research institution has access to customer data. So we could not send a newsletter and say, like, buy the product now. Only the research.
You would have to generate your own data.
Well, to be honest, we have iPads there, and if people want to sign up, they can, but it's not mandatory. So, and the thing is, you know what we mentioned before, I think it's completely normal that, look at some pharmaceutical research. I think 95% of all pharmaceutical research is done by companies who want to actually bring candidates for pharmaceuticals into the market, and they can finance the research because they generate money with it afterwards. And I don't want to say that we do it for the same reason. The reason why we do the pilot project is not to earn a lot of money with them, but rather gather data and actually show that legalization or regulation can be a good thing. But obviously, we need to finance the research that the universities are doing. And if you want to put it in a certain perspective, you can say that we almost give a loan to the university to finance their projects, and we pay the loan back by selling cannabis into the market. But we have to pre-finance everything. Like, you have to hire the stores, you have to design the stores, you have to do the branding, you have to educate the bud tenders, you have to pay the research, and all that needs to be financed. And that's the reason why I think 2,000 participants is probably a bit low. So we're aiming on something around 10,000 per municipality, depending on what the BLE says, maybe even more. But it's the same design also in Germany.
The police? Or? Did you say the police?
No, the BLE. Oh, what do you mean? No, we aim at 10,000 participants per municipality, and maybe even more if the BLE allows it. Yeah.
Okay, got it. Sorry. Okay. Okay. Deepak, did Canada some sort of research with universities to evaluate findings, facts, developments? How did that look like in Canada? Is what the study design, what data were collected, generated, and assessed?
Yeah, I mean, look, there's definitely a lot of partnerships with universities. Before I answer that question, I want to go back to one of the comments that Daniel made on age of access. And age of access was a big discussion when we were legalizing cannabis. We had the medical community that talked about the developing brain and said that, we should look at an age of 21. We're very concerned about 18-year-olds accessing cannabis. But we then went back to what was the reason that we were legalizing cannabis. There was 3 reasons. One of the big stools in sort of that 3-part stool was to make sure that people that are accessing cannabis are not under the age of 18, but people that are accessing it between 18 and 21 have access to safe product. And so what the government said was, we'll leave it up to the provinces. We recommend 18 as the federal government, and we'll leave it up to the provinces to decide what they do, and they mirrored that with their alcohol policies by and large. And the debate was really around not wanting to restrict people between the age of, say, 19 and 20 to 24, so that you're not leaving them out of the market and they're still going back to the black market and accessing it. So this was a really big discussion we have in Canada, and now what we've seen is there really haven't been massive negative impacts of 19 or 21-year-olds accessing cannabis, so you don't need to go as high as 24. With respect to your questions around universities, yes, there is a lot of research that's occurring. I would say it didn't start with the same way, where we didn't need to have pilot projects because we were federally illegal, so we didn't have to prove a point, if you will, around the data and all of that stuff. But now, in hindsight, there's a lot of research happening, both on the non-medical side, but also, more importantly, the medical cannabis side. We have tons of data and evidence now coming through around the different product formulations, right? Because now we have things like gummies, have things like extracts and things of that nature. So there's a lot of research being done on those sorts of products, and companies are now putting out safe and tested products as a result of that research.
Thank you, thank you. Forget to ask, for how long, what kind of period is
It's mostly 5 years.
5 years.
Yeah.
And that's a scientific rule?
Actually, it came from pillar number 2, I think, because they said something about 5 years, and then we just adapted it. I think this is the reason. It could be also 3 years or 4 years, so there's not really a rule. It should be long enough to really observe a change of behavior. But 5 years is just a number of years, I think. Yeah.
Okay. Yeah, let's come to the economic side of things. Economic expectations. What are your economic expectations with model projects? Do you want to earn money with that? Is that a bet on the future? Do you have a long breath to go through that till final legalization comes?
Yeah, I mean, look, we applied for 5 different projects in Germany. Among them, for example, as I mentioned, Berlin, Frankfurt, Hanover, and a few other cities. So obviously that will cost us a lot of money. So we have to, for example, in Berlin, we have Humboldt. For Frankfurt and Hanover, we have the Medical University of Hanover. Then we also have other universities in other cities. So obviously that needs to be paid. The stores need to be paid, the product needs to be paid, and then everything regarding bud tenders, education, and so on also needs to be paid. So our minimum would be to be able to finance all that with the sales of the cannabis. So there's no big profit expectation. If there's a bit more, then we actually have as costs. It will be good for us. But for example, what we also do, we voluntarily give money to the municipalities. So we have an LOI with the municipalities that I just mentioned. It's not that we just apply for a project. Now we actually have agreements with the cities. And what we said from the beginning is that we want to give them a part of our revenues to also finance prevention, education in schools, drug help and everything. So it is not an economic project for us necessarily. It's something where we want to gather data to actually moderate and constructively accompany the process of legalization or regulation in whole Europe. And I think the Swiss pilot projects are doing a great job of gathering that data. And the results in our pilot projects are amazing in Switzerland. We want to do the same in Germany, and hopefully this will lead at some point to a Europe-wide regulation. Because as I mentioned, like at the moment, you have only the medical sector, and the access points to legal cannabis outside medical are very limited. And I think if you really want to counter also the arguments of the conservative parties why cannabis shouldn't be legal, you need to show that a normal sales scenario in a commercial store is working, and that's data we want to get. If we get some money that we earn with those pilot projects, or if it means we get a license later on if Germany legalizes, that's obviously a benefit, but we are not counting on those. So commercially, yes, we have an interest, at least to cover our costs, but our main interest is really to gather data to show that actually regulation can work in Germany.
Yeah, great, great. Can you tell how many capacities did you invest in terms of staff and money? Is that can you tell?
Probably it's a 7-digit euro number that we would need to invest. Probably even higher than, like, it's not 1 million, it's a bit more than that for all the 5 pilot projects. But at the end, it depends, right? So we have spent already, I would say, lower 6-digit numbers on the applications, on everything in preparation. We have a team in Sanity Group who only works on that. So obviously that's investments we are doing. And then it depends. If all 5 pilot projects get granted, it will probably be cost around 3 to 5 million. If only 1 gets granted, it will be less than that. So it's actually, we budgeted for it, and we hope we get all 5 of them. But the question how much money you really spent on them before we generate revenues, we have to see once they started.
Okay, sure. So, what about the supply chain? What about the supply chain? How does that work? How is that is that intended or designed?
It's an interesting question because look, for the applications we are having, we are in touch with the authority, and there were some questions around it. So our original thought was we can just take medical product and repurpose it into pilot project product. So that way is not possible. So we have to import it for scientific reasons, not for medical reasons. So it means that we can probably use the same EU GMP suppliers that we're using anyways. However, we have to import it on purpose for the scientific pilot projects.
Or use the domestic.
Or use it domestic. So we have both ways that we can do. We have agreements with domestic producers who could deliver us product. We have also agreement with our medical producers globally who could deliver us EU GMP. But if you know the Swiss pilot projects, for example, they source locally. However, if it's not locally available, then there is the option to import. And we actually have both options ready, but at the moment we think it would be easier to import, and that's the reason why our applications are currently based on scientific import of medical cannabis.
Medical cannabis, so...
No, sorry, scientific cannabis, but it's basically the same form like medical cannabis. It's flowers, and then the open question would be if we do edibles, if we do vape liquids, if we do any other kind of dosage forms, will we manufacture them here or will we manufacture the ready product, for example, from Canada? I think that's something that needs to be part of the discussion with the authority along the way.
Yeah, the key point paper from the old government said edibles are allowed, should be tested. Yeah. Rather than with the situation we have now with the cultivation associations. It's not allowed, it's only rosin allowed.
I mean, to be honest, it's a balance. I understand the regulator behind it, right? So edibles look extremely attractive. You could theoretically run the risk that people who have never thought about consuming cannabis suddenly think like, oh, this I want to try. But on the other hand, as Daniel mentioned, it's the least harmful or the least harmful way to consume cannabis. And I know
There's
lots
a strong
of people,
market demand. For
exactly. I know a lot of people in good jobs over 40, over 50 who say, I'm done with smoking, but I need cannabis to go to bed in the evening, at least once or twice a week. And their product of choice would be an edible. And there's no way outside the illegal market in Germany right now to get access to an edible. So I think it's a very interesting thing to test.
Yeah. So, but these are real strict GMP requirements. You self-oblige you with 518 microbiological, etc. Or can that be different?
I mean, look, everything we do is EU GMP, so it's not a big change for us. You know, like yes, you could also argue that GACP is enough and you don't need to process it under GMP. But since we have access to all those products globally on an EU GMP standard, I think what we wanted to signal the authority when we applied is like, look, the cannabis we bring into this pilot project will be the highest quality possible, and that is still according to the belief of the authorities EU GMP, and that's the reason why we decided to go for the highest standard.
Yeah, got it. Okay, tell us, have you any reaction from the regulator? Are you in touch with the regulator? What is going on?
So we know for sure that they're working on it because we get questions already twice, forth and back, that we answer. We're currently in the process of answering them. So it shows us, and by looking into these questions, it looks like they really read the applications and they really have questions about it, which were good.
How many pages did you submit?
I can't remember, but it's definitely more than 10 questions that came back.
Now how big was your application? How many pages did you submit?
100 plus. Daniel, you know better.
I think it was 120 pages. and 80 pages for the ethically proposal, so in total 200 pages or something.
Oh, wow. Yeah.
But this was before there was a real form. Now there is a form available from the authorities, and now I think they made this because they had too big applications or too big proposals, too long proposals. So now it will be way shorter, I think.
Yeah.
Okay.
Can I just make a comment on something Finn said for people that might be not in Germany? I think there's something really important happening with the European cannabis pilot projects, and that is the imports that are happening for scientific purposes. Because so far we really haven't seen cannabis being imported outside of medical purposes, right? And because of UN treaties, kind of you're restricted on what you can import and export. But the fact that now Finn is saying that they're starting to import products under scientific purposes really changes that narrative that you can only export for medical purposes, right? Because the definition of scientific is already expanding. So I think in the audience, people that may be visiting from Canada or the US, this will really open up a number of significant opportunities for brands, for different types of products. Of course, in Germany, because of the restrictions around compounding and how you manufacture products, there's a number of workarounds that this provides to be able to get a lot of that high quality product as well as some of the major brands coming in. So I just wanted to make sure that point that he said was highlighted, because this is the first thing that we're seeing in Europe. And then that allows to have the conversation around, do we actually need to even change UN treaties, or are we good to operate under the scientific framework, right? So I just wanted to make sure that was
Yeah, it's medical and scientific purposes, the single convention, of course, sure. Okay, 4 minutes left. Some questions from the audience?
Let's hear it from the panel, first of all.
Thank you, guys, for the insights. Thank you.
Hi, Lawrence Minks, my name, from Research Gardens and Carbon Active. We are building facilities in Europe. One question, there was never an export of non-medical scientific cannabis in the world, to my knowledge. Maybe you know it better. I know most, like all countries that offer medical cannabis exports, they also offer to supply non-medical scientific cannabis, but it just never happened. Do you think it's an easy way to bring in imported cannabis? I mean, Switzerland, they use domestically produced cannabis, which I really like. I'm a participant in the Zurich pilot project. You have the same suppliers with extract that I favor. It's a really nice quality. Would you also favor cannabis cultivated in Germany to supply your pilot projects? And would you even assist such projects with Sanity Group?
Sure, absolutely. I mean, the thing is, we have 3 licensed producers in Germany right now. They have all the quantities that they need to fulfill for medical, but we are in touch with all 3 to potentially also serve the pilot projects if they get approved. So obviously, and to be honest, I would love to give the people even the choice to have, let's say, a German rec in the dispensary and have the Canadian rec and have the Canadian brands like Khalifa Kush that we brought into the market, or other brands, but then also German brands that are focusing on German cultivation. And at the end, let the customer decide which they prefer. So I'm actually a very big fan of local cultivation in general, because I think it's nice to have a local product when you consume it locally. But at the end of the day, we need to see what's more likely to be approved, what's more easy for us to handle. And as I said, in my best world, I have a portfolio of products that cover both international and local markets.
The original plan of the old government was in Pillar 2 in the cornerstone paper that only domestic produced cannabis is used for these model projects. But it's still, under international law, it's possible.
Yeah, but the thing is, what's interesting about that, if I may add that. So I like that idea. However, think about it. It's a 5-year pilot project. How many facilities do you want to build based on a 5-year pilot project that might get stopped after 5 years, and then you can write off your facilities? So I think the only option for that would be to use the medical facilities right now that exist to supply, because no investor would spend 15 million to build a facility knowing that in 5 years it can all be over. So that's the reason why I think import might be still a very important thing to cover.
Definitely.
I just want to answer the first part of that question. So to my knowledge, I'm not aware of product not being exported for non-medical purposes. It's either medical or scientific purposes. And Canada certainly will not export anything outside of that. So it really depends on, and that's why I was saying the scientific purposes is really interesting, because it really opens up the door to what you might be able to provide in terms of product offerings, as well as exporting those products out.
Fantastic. We have time for one more right there.
Yeah, guys, thanks for the discussion and for the panel. I'm here. My name is Dimi. I'm the cultivational director of one of the social club here in Berlin and Brandenburg. So we are operating already preparing some fire on the market. And the question that you said that it's a requirement not to be a medical patient to participate in the research. Could it be a member of the social club?
This depends on the study design. So these are the criteria the researchers can make up by themselves with the best knowledge to what is the best for the study. Yeah, I would say it would be possible, but it has to be transparent. So you had to say what you consume in the club and so on, but it would change a little bit the results of the study. If you're looking into a harm reduction or something, or into the consumption of cannabis, for sure you have to tell them if you smoke 20 grams additionally in a club, because this changed the whole database. But it is not completely forbidden or something. You just have to put this into your research design, I think.
Fantastic. Thank you. We are out of time. Let's hear it once again.
Thank you.
We will move along very quickly. I know everyone has to stand up and take their picture. Yes, that's right. Move around, mill about. This is the International Cannabis Business Conference Berlin 2025. VIP party tonight.